I'm Dr. Uday Sabarwal, and in this video we will be talking about a Domed Electrosurgical Unit. This device converts low voltage electrical energy into high voltage electrical energy which flows through the patient using the active electrode. After completing the desired action, the current flows back using the grounding electrode and comes back to complete the circuit in this machine. As we power on our unit, we have two knobs, one for the cutting and the coagulation, which has variable values between 1 and 10. For this example, we are using a chicken piece with a grounding electrode underneath it. This is the incision action using a needle electrode. We are first doing straight line cuts, and as we change the power, we will now demonstrate some mild and moderately accentuated scalloping action, which can be used in cases of gingivectomy. So you can see the cuts here. And we are also demonstrating an excisional action using the same electrode. So with this electrosurgery unit, we get these 7 electrodes. The model number and diameter of the respective electrodes is mentioned here. Electrodes C30C and C30S are used for incision only, whereas C40S and C40C are used for incision coagulation. On the other hand, EX22R is used for excision or depigmentation, whereas the remaining 2 electrodes are used for coagulation and fulguration. Now we will see the excisional action, which can be used in a depigmentation-like procedure using the loop electrode. So the common indications of this electrosurgical unit are frenectomy, gingivectomy, gingivoplasty, depigmentation or operculectomy, and many other things such as incision, excisional, biopsy. The contraindications, on the other hand, include not being able to use this with any flammable gas such as nitrous oxide, which we use commonly during conscious sedation. The other contraindications include that it should not be used in patients with pacemakers. It should not be used in close proximity to bone because it can result in bone necrosis due to the heating effect, and it should not be used in close proximity to metal objects. The common guidelines include having a cooling effect of at least 15 seconds with the loop electrode and 8 seconds with a needle electrode. The electrode should be used at a proper power setting, which should be determined according to the tissue type that you are using it with, and the right power, the contact time, as well as the depth of the electrode determines the success of your procedure. If you like that video, please hit the like button, and for more such videos, please comment and subscribe to our channel.